You are listening to The Scope, Phelps Health Podcast, Episode 20. Today we're talking about MyChart, Phelps Health's new patient portal. Let's get started. Hi everybody, I'm your host, Paige Reitman. The Scope Podcast is produced on a regular basis and can be found by visiting phelpshealth.org. Come back often and feel free to add the podcast to your SoundCloud stream or subscribe to our YouTube channel. You can also find us on Twitter, Instagram, LinkedIn, and Facebook. All links can also be found in the show notes. Now let's get into our show. Today we have two exciting guests, Phelps Health Epic Analysts Brendan Williams and Amy Jackson. Welcome to our show today.
Hello.
Hello. Thank you for having us today.
Absolutely. We're super excited to have you guys. So before we get started talking about Epic and MyChart and how exciting those two things are, what are you guys' roles within Epic at Phelps Health? Brendan, if you want to go ahead and start.
Yeah, so I'm an Epic application analyst. I've been here for 6.5 years and doing Epic now for almost a year. I work on setting up systems, helping to find solutions and improve the healthcare of our patients by getting better tools for our staff.
Wonderful.
And I'll echo that. I've been at Phelps Health for almost 3 years, and I'm with the Cadence and Prelude application.
Okay, so define that for me.
Scheduling and registration.
Okay.
And I've been with Epic as well for about a year. So it's hard to believe that it's been almost a whole year.
Yeah, has it flown by for you guys?
Yeah.
It's been a very busy year.
It's been a very, very busy
Not only
year.
have you been learning, you've also been implementing while you've been learning.
Yeah.
What a challenge. What an exciting challenge.
It is, but I think, it really prepares us for the support for our staff and our, when we do go live here in October. So it's really going to put us in a good position to be able to.
Yeah, you've already been doing on the floor training. What do they say, sink or swim?
Right? Absolutely.
You guys have been swimming. So, internally we're all super, super excited about our new electronic health record system called Epic. But what's going to be super great for patients is how much better their quality of care is going to be because of this system. So today we're going to talk about what that system is and what it looks like in that portal, which is going to be called MyChart. Mm-hmm. So kind of to get us started, Amy, can you tell us what MyChart is?
So MyChart is Phelps Health new patient portal. So you can access that by your web browser, if you have internet connection, as well as your mobile app on your phone. We'll be able to access your MyChart. So to sign up for that, you can visit Phelps Health in October when we go live, October 1st starting, and ask about it. Or you'll probably be asked about it because all of the employees are very excited.
We've known about it for months, yes. I am super excited
very
about
excited
it.
about it. So yes, you can either call Phelps Health to sign up or visit Phelps Health when you're at your appointment or at the facility with a loved one and inquire about it.
Awesome. So what will MyChart enable me to do as a patient? Why would I even want to sign up for it? Brendan, maybe you can take a stab at this?
Yeah, so MyChart is a great utility. You're going to have access to your medical records. You're going to be able to see your lab results, message your doctor, schedule appointments, be able to help see your family's health care and be able to participate in that. If you have an elderly parent, or a young child, be able to be involved in that. It's going to give you access to so much information, and really help you to have a better relationship with your provider.
One thing that I think is super cool too is that we can request prescription renewals, we can pay bills. I am so stoked about that because I have a prescription, and so every time it runs out I have to call a phone number and I have to dial it in, and it would be so nice to just hop onto MyChart and not have to do anything and just be oh, boop, there you go. Now I can go and get my stuff.
Yeah, absolutely. The prescription refill is an amazing tool. It really is going to save some time. And the online bill pay, this is one of the parts of MyChart I'm most excited for.
Why is that?
It's because today we have multiple different bills coming from different places. With MyChart, we're going to have one single bill, and we're going to be able to go in there and view that bill, make payments towards it, see those statements on there, set up payment plan, all of that. Accessible right there in one place.
Okay.
It's really going to be helpful for our patients.
Yes. So will I, as a patient, have access to MyChart immediately, on go live date October 1st? Or are there going to maybe be delays because of the Epic Go Live implementation?
So, you'll have access to it on October 1st. All of our clinics will go live on it. So, on October 1st, if you have an appointment, you will be able to sign up that day, right then and there.
So, I know we just kind of talked on this a little bit, but Amy, maybe you can take a stab at this one. How will messaging be helpful in MyChart?
Ooh,
what does that look like?
I'm very excited about messaging.
Okay, I chose the right person. All right.
I am. Both Brendan and I have had MyChart accounts with other healthcare organizations, and one of my favorite parts about my own MyChart account up in Kansas City, it was the fact that I could just send a message to my provider's clinic without having to call. So, which our Phelps Health organization has 24 hours to 72 hours to get back to those messages. And ideally, if clinic's not that busy that day, if you send your message that day, you would get a response back. So that's what we're really aiming for.
Yes.
But it just helps ease trying to call in for every thing that you need for your healthcare needs. That's going to eliminate the need to call. And by sending messages, it just gives you time to think about what you're saying, and really you can type as general a message as you want or as concise and detailed as you want as well. So I'm very, very excited about the messaging.
Well, and what I think is really cool about the messaging too, and maybe you can talk to this, is a lot of people may not do a really bang up job of keeping a good health record for themselves. And by keeping everything housed in MyChart, it's almost like a diary of their own health.
Yeah, it's kind of set up like your email, so you can see what you sent, and then you can see what you've received. And it does. It keeps that log, keeps track of those messages, so you can see, oh, when was the last time I messaged about this? And you can go back and look and say, oh, that was a year ago. I should go back and now it's time to renew whatever it is, medication, or it's time to go see your primary care physician. Well, I think that kind of segues right into making appointments on MyChart. But
Absolutely. Well, that's exactly how I was envisioning it is, you know, you have these series of questions and, oh man, while I'm doing that, I also forgot that I needed to make this appointment. Because you can ask like medical questions, you can do like medication refills, you can have like customer service questions. But I just think it's so cool that we have this diary now housed in our own health system for people to go and look at, and it's all very concise.
Absolutely. You know, and on top of that too, you'll have the ability to go back and, you know, review those messages at any point in time. Plus, we have the ability to send images. So if you have a, you know, oh, I have this rash on my arm, you know, is this something serious I need to have checked out? Well, you can ask, you know, a medical advice question and send a picture of that rash to your doctor's office and be like, hey, do I need to come in for this? And
Yeah,
like,
or
oh,
is it
no.
something I can just get over the counter medication?
Absolutely. It's going to really help communication and maybe cut down on some of those, you know, oh, do I really need to go to the doctor, or can I just do this from home type situations?
Which goes back to Amy's point of maybe if they're not so busy in the clinic, then they can answer you back within a day, which is exactly what we want, which is awesome. And it improves that quality of care for patients.
And I know firsthand because when I first started at Phelps Health, I was working in one of the clinic offices.
Okay.
And I was one of the ones to answer all of those phone calls. So I know
So you have your own list of things like honeydews.
So the more that patients sign up for MyChart and get their account going and able to send messages across will really eliminate or at least decrease the phone volume. So then the staff at those clinics have more time to get back to the patients in
that
the
need
most
to be
efficient
seen
way.
in person.
Yeah.
Absolutely.
So I want to take a step back and talk about billing again for a second, like billing and messaging. How convenient is billing going to be through MyChart?
Oh my gosh, it's going to be so simple. You can go in there and you'll be able to see your statement when it gets released to you. If you sign up for paperless statements, you'll get an email notification saying, hey, you have a new statement available, as well as if you have the app on your phone, push notification. You can go in there and quickly just make payments towards it. Like I said, you'll have the ability to set up payment plans. You'll be able to request financial assistance, as well as we have the ability to get estimates for common services provided here at Phelps Health. So you can go in there and say, you know, if I had a surgery, you know, what would that estimated cost of that be?
Before you go in and see your provider.
Correct.
That is so cool. So is there going to be like a fee to use MyChart, or is it completely free for patients to sign up?
No, it's completely free to sign up. So it's in everybody's best interest, in our opinion, to go for it and sign up and make an account. And I will say with MyChart and implementing Epic for Phelps Health, MyChart is really, in my opinion, as I'm sure Brendan will agree, the missing piece into the full circle of care for a patient. So if you have that MyChart account, you have all of these options, messaging, billing, making appointments, all of those things at your fingertips, which really helps empower the patient to take control of their own health care, which is something that Phelps Health really believes strongly in.
Yes.
We want patients to feel empowered about their health care, and MyChart is one of the great, if not the best tool out there in terms of electronic health record systems and patient portals to
Absolutely.
do it.
Absolutely. And that's the thing with Epic. Epic's goal is the patient is at the center of everything. And MyChart is just one of those tools that puts the patient right there in control. The more the patient has access, the better, patient outcomes are going to become. And this is going to be one of those tools that's really going to help us to get there.
That's fantastic. Yeah, whenever Amy was talking about how Phelps Health really wants to empower patients, it always makes me think about how in healthcare you are your best advocate.
Mm-hmm.
And having MyChart allows patients to really advocate for themselves and to reach out if they have questions, to pay their bills, to ask for help if they need help. Because Phelps Health is really here to care for patients. Yep. That is the only reason that we're here is for our patients, right? Why else would we be here?
Absolutely.
So how does somebody sign up for MyChart, Amy?
Well, I would recommend when you're at Phelps Health, at the organization.
After October 1st.
After October 1st, yeah. On October 1st or after, when you're at Phelps Health, for your own appointment, or if you're a patient at Phelps Health and you're there with a loved one for their appointment, you can inquire about it and ask to sign up. Or if you're checking in for your appointment, you may be asked if you'd like to sign up.
Is it a long process to sign up?
I would say it would take a couple minutes, so less than 5 minutes is a safe.
That's pretty quick.
So it is
like
pretty
a normal
quick.
registration.
Yeah, it is pretty quick. Yeah.
So whenever I sign up for MyChart, you kind of alluded to this. I can use it on my mobile device, right? It's an application.
Yes. So you can go to the App Store and download it on your phone. Which when you get your MyChart account initially, you can have your welcome letter emailed or text to you, and at the bottom of that it'll have a link right to the App Store, so you can just flow right on to the App Store and download.
Can patients do that ahead of time before October 1st? So like whenever they come in and register, they already have the app downloaded?
Yeah, so if they wanted to go out to either the Apple App Store or the Google Play Store, they could download. It's just called MyChart. It's made by Epic. It's got a little red icon. They can download that ahead of time if they want. And then at the time of their first appointment, we could send them that code. They can finish signing up at that point.
Yeah.
It'll be all available within that app. Outside of that, there's not really a lot we can do ahead of time, but that's going to be the one big thing if they want to.
Yeah, just so they know it's coming. It's going to be super cool, really exciting. So with MyChart, can a patient contact their provider, their nurse, literally from anywhere?
Absolutely, yeah. So anywhere you have internet, you have access to your health records, and you can reach to your provider at any point in time. We'll also be offering telehealth through MyChart, so if you have a video visit with your provider, you'll be able to conduct that through MyChart as well.
So a question I think patients will ask, and this is something that just came to my mind as a patient, is will I be talking to my provider always, or will it be their nurse? How does that work?
So it could be either or. The nurse will usually, triage the message as it first comes in, and then from there they would pass it over to the provider, or they would speak with the provider and then get back with the patient. It really just kind of depends on the question being asked and the situation. If it's just a standard refill request, typically the nurse is going to handle it. But if it's something more like, hey, does this rash serious, then the doctor would be the one to handle it.
Yeah, and then they'll step in and maybe have them come in person or whatever it is. Yep. So who can we contact if we have further questions about MyChart?
Well, we'll have a MyChart help email that will be promoted out, as well as a help phone number specifically for MyChart. So either one of those avenues would be the best way to get in contact if you have further questions.
So we'll have options for people. So we're not just leaving them in the dark. We're here for you guys.
Absolutely.
We know it may be a little bit of a process. I know I'm not always super tech savvy. My husband sometimes has to come in and help, and I have to walk away. So I may be one of those people calling you guys. So, whenever we get test results, can we see those in MyChart too?
Yeah, so you'll be able to get those test results in MyChart. Typically within about 48 hours. Some things will be a little bit longer depending on the test and the time it takes to return those results, as well as the provider to review them. But outside of that, you'll be able to get those there, as well as you have links to go out to get information about it. So say you had a blood test done and you don't know what that test is for, you'll have a link where you can go and learn more about it, as well as the ability to ask questions on those tests.
Which again empowers you as a patient.
Absolutely.
Because then you have knowledge.
Absolutely. That's the goal of MyChart, is to put the patient in control.
So I have another follow-up question to that, Brendan. So why are certain test results not shared electronically via MyChart?
Yeah, so some test results we don't share via MyChart because of either state laws or sensitivity nature of them. So it's better that we communicate it with a patient versus them finding out electronically.
And that'll be a call from like a provider or their nurse to have them come in office type thing?
Absolutely.
Okay.
Yep.
Okay, so Amy, this one's for you. If some of my health information on MyChart maybe isn't accurate, what do I do? Do I come in person? Do I call somebody? Do I delete the app? Not that, right?
Please don't do that.
Well, my first thought would be to contact that MyChart help email or call that MyChart help phone number because those will be monitored by the analysts, and we can help route that to the HIM department.
Okay.
To help answer that.
And what is the HIM department?
The health information, medical records department. So if something is inaccurate in your MyChart, I would definitely reach out to those two MyChart help email, phone number, and then we can get you the help that you need.
And we also have the ability to where you can send a message directly in MyChart, but from the customer service section. So if we have a question, about something that needs to be corrected, you can initiate.
Yeah, so we have plenty of options, which is really great.
Yep.
So what about like family members' health records? Because some people have like proxy accounts for like their children, or maybe they have like their husband's account underneath their account, and they're like their primary care for that. So how does that work with viewing a family member's account in MyChart?
Yeah, so for Proxy Access, we can set that up for either via the patient requesting it. So if the patient wants to give access to their spouse, they can initiate that themselves. Or if we have a child, for example, when you come into the clinic, we can help you set up that access there. And at that point, you have access to it within MyChart, where you can go in, quickly review that information. You have little pictures of the different family members where you can easily switch between them and view information there.
So what's different about MyChart versus like other proxy accounts that I've seen is that all of it's housed in one spot, right? So you don't have to have like 6 different logins for like your 6 different kids. Yeah,
exactly. Yeah, it's one login, and that's actually a great tool too in MyChart. On top of that, not only do you have that proxy access within there, we have the ability to link other organizations' MyChart accounts to ours. So if you have care done in another organization that is using MyChart today, you can easily go and request that to be linked there, and then you can see all that health information in one place and easily, conveniently have it available to you.
Yeah, and it's so comprehensive too. And like you said, it's going to be really easy to use. So one thing that some people may be concerned about as well is it's an app. Is it secure? Is my information going to be protected?
No, absolutely. It's industry standard security across the board. We do have password requirements in place as well as annual audits are done by our security team as well as the Epic security team.
Fantastic. That's good news to hear.
Yep.
So, we're kind of nearing the end of our show, but I want to give each of you guys an opportunity to share final thoughts or considerations that you have regarding MyChart, because I know each of you guys have spent, like you said, almost a year working on this implementation process, and you're both super excited. So I want to hear, maybe Brendan, we can start with you. Tell me what you're really excited about.
Yeah, so I'm really, really excited for this to go live. A big part of my decision to come over to the Epic team was for MyChart. I love the access to it. I love to empower patients, plus a little selfishness. I want to empower myself as well.
Yeah, you are a patient.
But, at the end of the day, exactly, we are all patients. And so having those tools available is something I'm just super, super excited for, and really looking forward to going live and getting that out to our community and getting people in there using the system.
Awesome. Fantastic. Amy?
Well, as I said before earlier, that I had a MyChart account up in Kansas City with that organization. And so when I heard that Phelps Health was getting Epic, I was like, oh, ding ding.
Don't mind if I do.
That means MyChart. And I was so excited about Phelps Health having the opportunity and ability to implement Epic, as well as get that MyChart patient portal up and going, and working, in a clinic office, and I got to meet all the patients and get to know them. And now we're more behind the scenes and not able to really talk and meet with patients, but at least with MyChart, which I'm very proud to work on, we can reach out to even more patients, but just in a different way. So we are behind the scenes working on the application, but we get to touch and reach out to all of the patients and help them in really a huge way. It's going to be awesome.
Exactly. It's a way to make an impact on our community without being, in the forefront, but being able to support, our providers, and giving them the tools as well as our patients the tools. It's ultimately, the end goal is to improve our community's health, and that's the most exciting part, really.
You guys are doing really great work. I know we've all been incredibly impressed with you all. So thank you so much for coming to our show today and kind of giving us your expert opinion about how exciting MyChart is going to be and what an awesome tool it's going to be for patients.
Awesome. Well, thank you for having us today. Appreciate you guys' time taking an interview with us.
Absolutely. So thanks so much for tuning into The Scope. If you liked our show and would like to know more, check out phelpshealth.org.